Hey guys, Dr. Justin Marcagiani here. I just did a podcast here with Evan Brand. We'll put the links down below on skin issues due to histamine. Really great podcast. I'm going to give you a little bit of an abridged version today in about 5 minutes or so, but definitely check out that full 30-minute podcast. So let's dive in. So what's histamine? Histamine is actually a neurotransmitter. It's made in the gut. It has a lot of different things with blood flow and inflammation. It's a neurotransmitter. Now, many people, when they have histamine imbalances, they start to have runny nose, itchy eyes, rashes on their skin, your conventional type of allergy symptoms. And most people are stuck in this loop of reaching for Singulair, Zyrtec, Allegra, a lot of these H1, H2 kind of histamine blockers. And a lot of times they have side effects, whether it's brain fog, fatigue, tired, sleepy, lack of being cognitively sharp. And so you want to get to the root cause, because why do you have these issues to begin with? You don't want to be stuck on allergy medications. And of course, the next step up from that would be some kind of a steroid or anti-inflammatory medication. And none of these things actually fix the root cause, right? So why are these things happening to begin with? So first thing is you have an environment issue, right? You have endogenous and exogenous problems. So exogenous means it's the outside happening to you. So environmentally, you're going to have, whether it's danders or pollens or mold or mycotoxins from the environment coming in, and your immune system is bathing in these things because you're breathing it in and it's creating an immune response. And again, typically with allergies, your immune system is overly sensitive. So we have to get to that root cause issue. But you have these allergens exogenously coming out to in. So a really good high quality air filter is going to be great. Most air filters that are HEPA-based may be okay. Some are going to be like the Air Doctor or the Austin Air are going to be better because there's a VOC component where there's activated charcoal or some kind of a carbon-based filter to it where it sucks up a lot of the VOCs and all these different foreign particles better. And so that lowers the amount in the air. Second thing is you can breathe these things in, come into a home that's really clean, but you have basically this hibernation area in your whole frontal sinus cavity where a lot of these antigens are just growing and just kind of just hanging out. And so you got to flush these things out with a high quality saline flush. And I typically will even add a couple of drops of iodine or silver to flush out the biofilms and to knock out any resistant bacteria or fungus up there. And that flushes things out and really cleans that cavity. Done a video on this, but you want to flush for about 2 to 3 seconds each sinus. And you don't want a neti pot. A neti pot's like watering. It's like trying to clean your driveway without having a surface washer, right? You need that high quality pressure to break things up. And so that really good sinus bottle or a nasaline really creates that pressure. So watch that video. We'll put down below in the show notes on sinus flushing. And I'll even use some Xlear Rescue or Xlear Max spray. It can be super helpful to kind of break up biofilms and allow things to get sloughed off and flushed out better. So we have the outside environment. We have the inside environment, getting your nose clean, getting your gut bacteria in balance. There's different bacteria that can actually produce histamine, whether it's Pseudomonas, Klebsiella, Citrobacter. These bacteria actually produce histamine. And when you have high amounts of these bacteria in your gut, you're going to have this histamine reservoir going, and then you're going to have these symptoms happening as a byproduct. Now, why is that histamine there? Typically, it could be from antibiotic use. It could be from lots of processed food, or just you have imbalances and you have to really work on restricting fermentable carbohydrates, and you're growing these bacteria. You could have low stomach acid, low enzymes. Inflammatory foods could drive these things. If you're feeling any level of bloat or gas or motility issues, there's a good chance that you have some of these bacteria in your gut and they're out of balance. And so knocking down those bacteria can be a really big deal out of the gates. Now, people that have bacterial imbalances, a lot of times stomach acid's a big deal because low levels of stomach acid make it easier for bugs to grow. This is the reason why a common like cleaner, right, on the table, is white vinegar or apple cider vinegar. You put these on a rag and you wipe things down. It's a great cleaner. Well, white vinegar is acetic acid, right? So it's very high. It's very low pH, right? Low pH means more acidic. And so in our gut, when we have good levels of acidity in our stomach, especially, that's going to make it harder for bugs to grow. And then when we break food down better due to good acidity levels, that allows us to break down and absorb and assimilate our food better. Again, foods that are not broken down adequately can be a stressor on the body because we have to break them down, absorb and assimilate and get those nutrients from our gut into our bloodstream. And if we don't break them down well, that can be a problem. And again, 80% of our immune system is in the gut. So anytime you have immune issues, whether it's allergies, or any type of autoimmune thing, whether it's skin, eczema, psoriasis, anything skin related, you have to look at the gut. So you have the GALT, which is the gastric associated lymphoid tissue. That's all the immune cells in your stomach. Then you have the MALT, which is the mucosal associated lymphoid tissue. That's in your small intestine. When these cells are overstimulated due to poor foods, due to gut permeability, because these your enterocytes are opening up a little bit, foods and particles and endotoxins and bacteria are getting into the bloodstream. That can create a lot of immune stress, and that can make the immune system kind of go high alert. And then it's responding to all these antigens out in the environment. So that's a big deal as well. And topically, we can do things to help as well. I mean, you can do, I like witch hazel topically for skin issues. It's an anti inflammatory, and it also helps with blood flow and just kind of helping the healing process. Witch hazel is wonderful as a topical. But again, you have to look at it and say, what's the root cause? It's still not going to be a root cause supporter, but it's definitely a good palliative as well. Isopropyl alcohol for bug histamine bites, skin histamine bites, excellent as well. A lot of times, the typical conventional way is going to be corticosteroids, or it's going to be like an immunosuppressant drug like Elidel or Eucrisa, like a tacrolimus or a picrolimus medication that kind of suppresses the immune system. But that's not getting to the root cause. So anytime you have skin related issues, you have to look at the gut. The gut's a big deal. That's where 80% of your immune response is. Now, topically, you can also do red light. Red light's wonderful for eczema, wonderful for psoriasis and skin-related issues, very anti-inflammatory, supports blood flow. It's another great option to kind of help with the healing process, but you got to go look at the food, your digestion. You got to look at gut permeability, because the more permeable your gut is, the more you're going to have immune responses from food and bacteria going in from the gut into the bloodstream back into your body systemically. We have to look at the bacteria issues. We have to look at the environment. And we have to look at your whole frontal sinus cavity to make sure you're not bringing things back in. Hope that helps. Again, environmental mold can also be a big thing. So you have to do some testing. You got to look at your gut. You have to look at potential mold in your house, mold in your environment, maybe mold in your body, and potentially your hormones. People that have very low cortisol levels, very low hormones, low progesterone, low cortisol, I find that people tend to be more sensitive and have more allergy-related issues due to their inflammatory system being very low and depleted. So you got to look deeper at the hormones. That's going to give you a good reservoir and a good buffer to be able to deal with stress and have a healthier immune response. All right, guys, this is Dr. J here. Hope you enjoyed today's video. If you did, let me know. Thumbs up. Let me know in the comments. Helps the search algorithm. Also, I see patients worldwide. If you want to dive in, roll up your sleeves, and go deeper on this, there'll be my coordinates down below to reach out. All right, guys, have a phenomenal day.